Okay. Hi everyone. I hope you're all doing well. Welcome to this webinar. I am Rajnandini, Psychologist and Research Associate at RehabPath, India office. We are a medicine-based startup with the mission to help patients and families struggling with addiction by connecting them to the right rehab center. So we work with around 1,700 treatment centers in India. In today's webinar, we will be discussing mental illness treatment and rehab with MindPlus. And our guest speakers are Mr. Pankaj Mahal and Ms. Sufia Nusrat. So this is going to be about a 1-hour session. Feel free to drop your questions anytime on Facebook or on Zoom. And we will take the questions at the end of the session. So welcome again, Dr. Pankaj and Ms. Sufia. So before we start and get into our topic, could you tell our audience a little bit about yourself and how your professional journey has been so far?
Okay. Hello, everyone. So my name is Dr. Pankaj Mahal. So I have done MBBS and MD in psychiatry from AIMS Delhi. And then I did my senior residency at AIMS Jodhpur. And then last year I was at NIMHANS Bangalore, okay, which is one of the Apex Institute of Mental Health. And there I did fellowship in forensic psychiatry. I've also had done diploma in medical law and ethics, and currently I'm attached with the MindPlus Health Center for the past 2 months here.
Okay.
So I guess Sufia ma'am will tell about herself.
Hi, hello everyone. Firstly, I would like to thank RehabPath for inviting us to this forum. Thank you, Rajnandini, for giving us the welcome. And so I'll start with introducing myself. My name is Sufia Nusrat. I am associated with MindPlus for the last 3 years. And surprisingly, today is my work anniversary. So I complete 3 years in MindPlus. So I have an overall experience of working in a rehabilitation facility for over 7 years, like 7+ years. And I have finished my MPhil in 2015 from Central Institute of Psychiatry, that is in Ranchi. And basically I'm from Kolkata. I am born and brought up in Kolkata. I finished my master's in Kolkata from University of Calcutta, and then I moved for my MPhil in Ranchi. So since 2015, I've been working. I was placed in a rehab center in Bangalore. There I worked for over 4.5 years. Again, I mean, that is Cadabom's Hospitals. It's one of the finest rehab in the country. And then I moved here to Punjab, associated with MindPlus for the last 3 years. And the designation that I have here is that of a lead clinical psychologist. So yeah, this is me in some total.
Okay, both of you have a great, very impressive career so far. And I'm really excited to have this conversation with you. And congratulations again, Ms. Sufia, for completing 3 years in MindPlus. So, yeah, could you tell us how MindPlus started and what it's all about and how it's different from other treatment centers?
Sure. So MindPlus is like, this is the 36th year of its, foundation. So yeah, it's one of the premier institute in North India, and it's Dr. A.K. Kala. He's a very renowned psychiatrist and very well known in the psychiatric field of India. So he is the founder of this place, and now his son, Dr. Kunal Kala, who is also a psychiatrist, is taking the journey ahead. So we basically have 2 branches. One is in the city, the mainstream city, Ludhiana, where we run the outpatient services, and one we have in Doraha, which is outskirt of Ludhiana. So it's based in a 5-acre lush green campus, and this is the basic residential facility that we have. So yes, this is the residential facility, and when you're asking how is it different or unique as compared to the other rehab centers, I would say, okay, it's the team that defines our uniqueness as compared to the other rehab centers. I'm sure all the rehab centers are doing very well, but I would particularly take pride in the team that we have. We have a multidisciplinary team, expert in their field, well trained, well equipped in terms of managing and handling patients with psychiatric disorders. So, right from the nurses to the staff to the ward attendants to the psychologists to the consultants, we all work together as a multidisciplinary team approach. So, another thing that defines our institute here is the unique, patient staff ratio. So, because like it's like 1:5, so we have good number of trained psychologists and psychiatrists, so the patients get very individualized care, okay, and the treatment is very holistic in nature. It's a very comprehensive nature. It's tailor made to the need of the patient. So the patient, is involved in intensive care throughout the day, and the psychiatrist meets the patient daily, the psychologist meets the patient daily for one-to-one session, and the group sessions are obviously, keeping them occupied and also give them a structured environment. So I believe, this team and the effort that we kind of, give towards the service of the patient is very unique. The patient, particularly the patient staff ratio. So this is something which kind of, makes MindPlus stands apart. So yeah.
Yeah. I've also gone through MindPlus website. I've never visited the center, but I can see there are various things happening, and it all looks very impressive. And like you said, with mental health and addiction disorders, these disorders are so complicated, and it affects various aspects of a person's life. So it's important to have a team working towards and making sure you're making improvements in every aspect of that disorder. So that sounds great. Is there anything that you would want to add, Dr. Pankaj?
I guess matlab, the kind of the treatment which a private institute is giving in MindPlus, and that too in Ludhiana. See, so the problem is that at government institutes also we have seen that the patients were not having any place nearby where they can get some kind of evidence-based treatment or some good treatment regarding their psychiatric condition. So in such a way, I can see that in Ludhiana or in the state of Punjab, this institute has been providing good psychiatric services to a lot of patients, and a lot of patients are itself testimony to the way the institute has been grown over the years. So they are also perceiving the importance and the use of this institute, which is making one of the good institute in psychiatry, at least in the North India, I can say. And the same can be said over throughout the India.
Makes sense. Okay. I hope MindPlus keeps growing like it has been the past few decades. So let's get into our topic, which is mental illness treatment in a rehab. So to start with, let's briefly talk about what mental illness is and what causes mental illness generally in people.
Okay. So before diving into what mental illness is, we need to know what is mental health first.
Right.
Then we'll able to differentiate what is mental illness and what is mental health.
Right.
So mental health, as we can see, so WHO has given some certain kind of definitions, and everybody has tried to explore this topic, what mental health is actually. So if we say in a broad term, so mental health is like if a person is able to handle his daily routines, the daily stressors which is there, if he's able to cope up with those kind of stressors, if he's able to work well, perform well, and if he's able to contribute something in the community in which he has been living, then we can say that that person is mentally healthy. Okay.
Right.
But not having any of these aspects doesn't mean that he is mentally ill. Okay. So mental illness, we can see it as a kind of a spectrum. On a one end of the spectrum, person is completely mentally healthy. On the other end, he is mentally ill. But in between also, he might be having some kind of a problem, which may not be up to a mental illness level, but these are some problems. So if some help is being given to this person, he can again shift to being a mentally healthy.
Right.
So what is mental illness then? So mental illness is when there is a gross disorder or a substantial impairment. It could be in your mood, in your thinking, in your way of perceiving the things, in the memory. Okay. So all of these things will have an impact on your behavior, on your judgment of the situation, okay, on your understanding the reality. Okay. So if these things are being impaired because of any of these items, then we can say that this person might be having some kind of a mental illness. So these could be psychiatric condition, and these things can also occur in substance use patients also. Okay. So any kind of a substance use patient also are mentally ill. But if we go specifically to the definition, then the definition has excluded the mental retardation from the mental illness definition.
Oh,
So this is how a mentally ill person and a mentally healthy person is being differentiated.
right. And with treatment, people can move from one point to the other in that
Yes, so
continuum.
it's a spectrum. So we try to keep the patient from another spectrum and try to take them or bring them to the mentally healthy spectrum.
Right. Okay. Really, really well explained. So I think when people think of treatment for mental illness, very few people know that rehab is also an option. So what is psychiatric treatment or psychiatric rehabilitation like? And how much does the general public know about this option?
Right. So, see, psychosocial rehabilitation is basically a process of restoration of community functioning and well-being for a person suffering from a psychiatric disorder.
Right.
So, who has not benefited much from an outpatient treatment or short-term inpatient treatment. So, psychosocial rehabilitation or psychiatric rehabilitation is basically intensive care where we are working in different phases. There are different phases of treatment here. So say we can say that phase one, which is the stage one, is assessment and diagnostic clarification. So there is intensive assessment done so that we can reach to a proper diagnosis, formulate a treatment plan, and go about the treatment. So the first phase is assessment, clarification, and diagnosis, plus management of the symptoms, the acute treatment, you can say. And then the next stage is more about their activities of daily living, the structuring of the environment, the individual therapy sessions, the group sessions. So where in these in this environment where they are somewhat like trigger free. I always use this term trigger free. So they're trigger free. They are not in that chaotic environment, and they have come and they are in a community where they are receiving help in a safe and therapeutic environment, and particularly catering to their well-being, social, occupational, emotional, psychological, in all aspects. And in the later stage, we also kind of work on the vocational and occupational rehabilitation so that the person is enabled or equipped, to go back to its natural setting, to the natural community, so that they are kind of functioning better, and recovering from illness is not the only target of psychosocial rehabilitation. It is basically recovering plus reintegrating them back to the community. So this is the concept of psychiatric rehabilitation or psychosocial rehabilitation. The second part of the question is how much people are aware that for psychiatric treatment, something called as residential treatment or rehabilitation works. I mean, I think the awareness is not so great in India. So yes, even when we have patients coming into our outpatient, so they have tried a lot of treatment. They visit from doctor to doctor, yet there is barely any improvement. So and I have often found myself explaining them, okay, it hasn't worked, so we have to do something different, something better, something deep, and that is only possible when we have the patient with us 24 bar 7, when the patient is kind of is under observation and supervision, and we can monitor it. So I have seen that lot of patient that comes to us, they are totally unaware that such kind of treatment is available, and there is the outcome is also promising. So I have been educating lots of families, and they, again, I mean, because they are very very helpless, the caregivers, they are really helpless. Even the patient who is suffering, I mean, it's very hard for them, if they're not getting the right treatment. So they are going from places to places, even kind of moving cities, they even go to different cities to get treatment. And so when I suggest that we can go for a rehabilitation center, which is a long term care, which is an intensive care. So first, it seems to them like it's very surprising. It's like, how can we kind of go about this? I said, but then again, I mean, it's steps. Psychoeducation takes us some steps to step by step.
Right.
We psychoeducate the family, and then when they admit, when they actually complete the program, they actually leave the place with smiling faces. So
Yeah.
I'm really glad that we have Path is kind of taking this initiative of reaching to the mass, so that they are more aware of what a rehabilitation treatment is.
Yes, yeah. And I think having a robust outpatient center like you have makes it easier for you to be able to help people and guide them when they need rehabilitation. Uh, so I think, like Dr. Pankaj said, going from one continuum to the other, this is how it perfectly works in a rehab, because their whole focus is on recovery, and from not being functional to not just getting rid of the symptoms, but also going to the other end of the spectrum and being completely functional and healthy, being able to deal with the daily stressors, is the final outcome of a rehabilitation center. So that's
Yeah. So just to add on this
yeah,
thing, so recovery is like reaching the goal of mentally healthy, and rehabilitation is the path which we take in order to achieve that thing.
right.
So that's
Yeah,
how rehabilitation works.
yeah. Simply, very simply put, amazing. So now that we're talking about mental illness, and there are different kinds and there are different types, like Dr. Pankaj also very briefly explained. So, what are the kinds of illnesses that can be or are usually treated in a residential or rehabilitation setting?
Okay. So in general, the rehabilitation has been brought out into concept because of the kind of the mental illness or the impact these mental illnesses make on an individual. Okay. Initially, the concept was that only the severe mental illnesses which have been there, only in these illnesses we need to have some kind of a rehabilitation. Okay. When I say severe mental illness, I tend to mean psychosis, schizophrenia, or bipolar disorder. Okay. But gradually it has been seen that even the common mental disorders are like depression, anxiety, or even substance use disorder, even though they don't impact the person as much as the schizophrenia or bipolar, but the dysfunction the person has been having because of these disorders also is quite high. Okay. That's why rehabilitation is not confined only to the severe mental illness, but also for the common mental disorders. If the patient is not able to lead his life in the way he wants to be, or in a way he is expected to be. Okay. So in both the situations, rehabilitation can work. So in severe mental illness, you will have different approach, you will have different goals, while in a common mental disorders, you will have a different goals. So in common mental disorder, the person is not that much disturbed. He's able to, like, let's say he's able to go to the work, he's able to go to the school, but then he's not able to work productively. So we can teach him, or we can educate him, or we can develop some of the skills by which he can improve his occupational work and all this. While in severe, even the basic things are not being done. So we work on the activities of daily living, how to have a social skills and all of those things. So the rehabilitation can work in both the ways. More severe the illness, the rehabilitation needs to be done more. In less severe illness, the rehabilitation would have a confined role. So that's how it would be done.
Okay. So it doesn't depend on the type of mental illness, but people can reach out and get help in a rehab center for any mental illness. Just that the approach will be different for each.
Yes.
And maybe the time period that they require would be different. Okay. All right. So most people would have taken outpatient treatment before opting for inpatient or residential treatment, and people are more familiar with outpatient setting treatment. So, what is the difference? How is outpatient different from residential treatment?
Okay. So basically, in outpatient patients, we can do treatment for a, let's say, less severe illness or the illness which is not causing much of the discomfort or much of the impairment to the patient. He's able to handle a lot of things, but he's not able to handle few things.
Okay.
And he has a good support system or the social support. Okay. And the duration of the illness is not too much. It's let's say keep few days, few weeks, or maximum few months. Okay. And patient has some kind of an insight into the problem. Okay. If these are the conditions, then even an outpatient treatment can work. Okay. Or if he needs some kind of a specific, if he has some deficiency in specific skills, it can be taught on a OP basis or outpatient basis. Okay. But if we do the things opposite, or if the patient is having opposite things, for example, if the illness has been for a longer duration, if he has not been able to do any kind of a productive work in his life, for example, he's being unemployed, he is not able to take care even of his activities of daily living, take care. If he is not able to socially interact with others, if there are too much medical or psychiatric comorbidities associated with the illness which he has been having, okay, then in such a situation, to make the patient to be capable of understanding the things, we need to have first inpatient setting so that we can teach him basic skills and continuously move up one skill at a time. And subsequently, after he gets stable or in that kind of a frame of mind that where he is able to understand the things, we can shift him from the IP basis to a OP basis. So rehabilitation is a longer process. He may not need to be in an inpatient setting for a complete rehabilitation, but till the moment that he's able to understand the things, he needs to be in an IP care.
Okay. I think it's quite similar to even other physiological illnesses, right? To some extent,
Yes.
when it's manageable and you're still able to take care of yourself, go around doing your work, it's okay. You can deal with OPD and just take care of yourself at home. But if it comes to a point where you're not able to get out of bed or go to work, then it would make sense to go for a higher level of treatment. Okay.
Here I would like to also add, see, a lot of time it also depends on how much awareness the patient is having about the illness, about the disorder. Because one of the challenging aspects that we commonly see is that they do not have that understanding that yes, this is something that has to be taken care of, in a proper manner. Not, okay, that band-aid approach is not going to help. It has to be treated in a proper way. So, even then, when we admit the patient, or when the transition from outpatient to inpatient happens, so this is also one of the marker, okay, if how much understanding the patient is having about the illness. Like, the patient may be brought by the family, but the patient is not aware that, that my problem is a problem. Like, say for example, that okay, I'm just having a rough patch, it's no big deal, but the level of socio-occupational impairment is massive, and it is taking a toll on the caregiver or the family members. So even at that point of time, so they will also need like I said, intensive care. Like, it's basically a very the assessment will be very important here. And then building insight is another aspect here. And moving out, like, the stay, the duration of treatment in the rehab will also depend how much responsibility at the end of the day, if not for the severe mental illness I'm talking, for the common mental illness that I'm referring here, is at least they're having some amount of an insight that yes, I'm having a problem. It is of mental illness category, and I need to take medication, and I will take some responsibility in the recovery of it. So this is an ideal kind of a recovery or prognosis that we look at. So yeah.
Okay. Right. I can imagine why there is this resistance also and denial towards illnesses, because there's also a lot of stigma around this, right? And it's very difficult to reach out for help in environment like that. So I'm guessing that it must be difficult for people to make a shift from outpatient to inpatient as well, and to be able to recognize that no, maybe this level of care is not enough and I need to go ahead and look for something else. So, what are some signs that indicate that they need a higher level of care and need to think of looking for a residential level of treatment?
Okay. So again, it would depend on kind of the impairment or the dysfunction that the patient has been having. For example, if the patient is acutely symptomatic, then he needs to have first his symptoms controlled. Okay. If symptoms are too severe, then he needs to be as a residential setting. If the symptoms are minor or not causing much impairment, that could be handled in OP care. Then even the lack of symptom doesn't mean that he is not having any problem. Okay. For example, if the patient is asymptomatic, but still he is not able to do anything, he's not having the will to do anything, he's not having the volition to do anything, then also he needs to have some kind of a care, some kind of a help. Then comes, suppose if he wants to do something, but he's not getting the opportunity to do anything, then in that also the rehab has its own place, that how you can connect that person to the kind of the opportunities which he should be having. And as we all know, the mental illness has, even though the stigma is decreasing, but still the stigma has been there. So because of the stigma, also the person are not able to achieve the optimum level which they want to have or which they wish to have. In that also the rehab settings or the rehab care helps him to achieve those things. And the lastly would be the skills. Sometimes we are not having a certain kind of a skills. Either we have not developed that skill, or after a period of time we are not able to execute that kind of a skill. So either to develop that skill or to refine those skills, you need to have some kind of a rehab care, which can be more intensively given in a residential setting as compared to a OP setting.
So, like, to add to what Dr. Pankaj said, see, there are also certain indications when we suggest immediate admission in terms of when the patient is, a threat to himself or others, when there's a violence risk, when there is a risk that he will be a threat to the society in general, not because, like, not that he is doing it on purpose, but obviously he is symptomatic, but not other people may not be aware of that, and he may kind of he or she might end up being in more trouble. So when the indications are there, we definitely recommend for a rehabilitation treatment, where the first target is crisis intervention, symptom management, and then kind of moving to the second stage of treatment, that is the skill building and therapy and the community testing and everything else. So
Okay. So I think rehab gives you all-round support and supervision if required, which would be very difficult to achieve through OPD.
yes.
Okay. So what are some benefits that one gets out of being in a residential facility? Because like you said in the beginning, Sufia, how you have to educate people about how this can help them, and then eventually when they do go ahead with it, it does show better improvement. So what are these benefits that people get out of rehabilitation?
Personally, I would say that, like I said, it's a environment where the focus is care. Okay, and we try to create a therapeutic and safe environment where they are feeling safe to communicate, to interact, and the security sense of belongingness is there. It's not a very typical hospital setting. It's like the setup that we have. It's very homely, so they do not feel that they are hospitalized. So they have that feeling that yes, they are in a retreat. So our the name of our organization is also MindPlus Retreat. So it is a retreat facility. So they feel very homely, and at the same time, we monitor their routine. First thing that we try and look at is, after symptom management, the structuring of the day, the activities of daily living, self care, time management, eat like physical health, eating well. A lot of patients who are having symptoms, they have disturbed appetite and disturbed sleep, so we try to kind of focus on that. So again, giving a structured environment, giving them instructions, giving them supervision, then moving on to the individual therapy where their their like personal things, the problem that they have come. Because see, of course, it's a group setting, it's a community feeling. The community feeling is also another advantage, that they feel that we are not alone. And there are others similar to, they are also having the same similar problem as us. And so the group therapies that we have, that also helps a lot in giving them a support. Like the stigma that we are talking about, it is nothing but lack of support and judgment. So here they absolutely do away with that. They feel the support of the community. They feel the support of the treating team. Plus, the care that they are receiving in terms of the individual treatment plan also. So that helps them with the skill building, uh, working on their coping abilities, harnessing their strength, and then utilizing them for a better reintegration back to the community. So again, it's like step by step, from very basic, we kind of scale it up through different stages. Like first we start with the basic daily living up till the vocational or occupational training that we provide them.
So there's really no problem that's left out, no matter what the nature is. It is addressed when the person is there in the facility the whole time. It's impossible to miss out on any problem, be it sleep or eating problems. Everything does come under the treatment plan then.
Absolutely.
Yeah. So, is there anything that you would like to add, Dr. Pankaj, on the benefits of rehabilitation?
So, as Sufia ma'am has summarized this thing, so these are the main benefits that the patient is having. Also, patient develops after achieving certain kind of a skills. Patient himself develop the confidence that now he has achieved these things. So some of the deficit which the patient might be having, they also tends to improve when a person develop one kind of a skill set. So subsequently, the same kind of a improvement you can see in other domains of the life also. So with the working on one domain, he can improve the other domains. So these are also some of the benefits which the patient might get if he gets the required rehabilitation care in his condition is essentially required.
Okay, right. Um, so, talking about the treatment and how it works, and I think Ms. Sufia already briefly explained how it starts with first the diagnosis and the assessment. But what is the overall plan for treatment for a mental illness like in a rehab, and does it differ depending on the type of disorder?
So, when we talk about the treatment plan, first we have to see that on a what level the patient is currently. So, what I mean is, if the patient is acutely symptomatic, then at that point of time, rehabilitation can't be the first thing to go with. First, we have to control the patient's symptoms, and to control the patient's symptoms, The first plan would be doing a detailed assessment, see what all the problems the patient has been having. First, other than this, is to rule out whether he is having actually a mental illness or these mental illness are the manifestation of some other problems, some other physical ailments. For example, the neurological disorder tends to have some kind of these mental symptoms or mental illness symptoms. Okay. After ruling out those things, you will get your diagnosis. Then after the diagnosis, you'll do certain kind of assessments to rate the mental illness which the patient has been having, give him certain medication, see the response of medication. After his symptoms tends to improve, at that point of time, you start to know what kind of a skill deficits the patient is having. Why is he not able to achieve the things which he aims for? Okay. What are the barriers in achieving those things? And subsequently, you'll make some kind of a chart or some kind of a list that these are the things which the patient is being deficient on. And then you start to work on one skill at a time or one deficiency at a time. And then you see the response in the patient. So the treatment, it takes in psychiatry or in a mental illness field, it doesn't occur quickly. It's not an infection that you have given 5 days of medication, patient would be all right. So considering that the symptoms doesn't develop in a go, so they also doesn't remit in a go. But the side effects of the symptoms or the implication or the impact of these symptoms remain with the patient if it doesn't get the adequate care. So that's why after symptoms start to remit or to decrease, then we start to have more of a kind of a psychotherapeutic approach. It will we try to do his assessment of the setting in which he has been living and the environment, how we can modify the environment so that the patient can get benefit and he can achieve his true potential. So that's how the treatment plan goes about. And under the rehabilitation thing, I guess Sufia ma'am will tell you what all rehabilitation care we can provide.
So basically, like Dr. Pankaj mentioned, stage, like we say that's stage one, stage two, and stage three. Like stage one is about the assessment and formulation and diagnosis and active symptom management. Stage two is the therapeutic and skill building phase. And stage three is again like the pre-discharge counseling and post-care treatment plan. Because see, the rehabilitation is one part of the treatment where we are focusing at skill building and enabling the patient to uh, to feel confident, to feel that okay, yes, now I am kind of in a better position to deal with my life challenges or situation or emotional problem or psychological problem. And they kind of step out, so the treatment doesn't end then. So the last part of the treatment is focusing on terminating the entire treatment and then making up a plan so as to how we are continuing the treatment in terms of regular follow-up, medicine, therapy sessions, again booster sessions. They are very very important to create a sustainable change. So again, I mean, we when we are talking about recovery, recovery has to be sustainable. I mean, if we kind of okay fine, like I was saying, it cannot be a band-aid approach, like a one-time thing. We did it, and healing has taken place. The patient is doing very well. Now you are off. You're by yourself. We can't just do that. We have to kind of be with the patient for a considerable amount of time, even after discharge.
Right. Okay.
Yeah. So it's again a very all-round kind of a plan that we look at.
Okay. So I think what I understand is that broadly there is a systematic plan where you start with assessment, you treat the symptoms, and then you work on the skills and do therapy, look out for maybe deeper problems, and then eventually until the patient gains enough confidence to be able to tackle those problems himself, and then continuing care after that.
Yeah, so sorry, I just missed one part here, Rajnandini. We also kind of work in community testing, where before discharge, we do not discharge them straight away. So what we do is, so we have a lot of family sessions also in between. Other than individual and group sessions, we involve the family as well. So that, see, they're again going back to the family, right? So the family also has to be psychoeducated. They also have to be equipped so that how to handle the patients, how to take care of them, how to take care of themselves. So even families are also a very integral part of the treatment. So what we do in the last phase of treatment is we go for community testing, where we send the patients out for shorter duration. Like, the patient is sent out for lunch first with the staff, and like escorted, and then unescorted, and then with the family. So, maybe a day with the family, shopping with the family, so that we are kind of slowly preparing the patient to go back to the community. Not, okay, they were here for 3 months or 6 months, and suddenly one fine day we discharge them, like, so we slowly reintegrate back them to the community. So that's how it is. I missed the community integration part.
I think that's very essential because I have seen that stands out as one of the limitations of the residential treatment is that you're away from your setting, you're away from your triggers. So you're going to feel better. And then when you go back, you're not prepared to face those triggers. And I think this kind of a method would work perfectly well because they would go out and experience what they do and then come back and see how they can deal with it, learn to handle those situations. That's a very good plan. I don't know how commonly this is done, but it sounds like a perfect aftercare plan.
Thank you.
Yeah. So another thing I understood is that it really depends. The treatment plan really depends on the person's symptoms and their improvement and what works for them. So at every point, I think it is customized based on what's working for them, right?
True. It's very tailor-made to the patient's need and the diagnosis and the type of treatment that they need.
Yeah. Starting right from assessment itself.
Absolutely.
Right. Okay, so most often when people have mental illnesses or addiction, it's never just a standalone disorder, right? There might be other things that are happening, some other extra symptoms or physiological problems or other mental health disorders. So for people with these co-occurring disorders, what is the best, form of treatment to go ahead with?
Okay. So if we consider, let's say, psychiatric illnesses and substance use disorder, both are quite common and both can precipitate each other. So if a
Right.
person is having substance, he is at risk of having psychiatric illness. And if he's having only psychiatric illness, then he tends to go towards the substance. So it's very rare to find any person who is just using the substance, not having any kind of a psychiatric. So
Right.
that's the thing. That's why when you treat these patients, you need to be cautious about not to let pass any of the symptoms. Sometimes the patient are not too open, they are very much guarded. They'll just tell you that they are not using that much amount of substance and they are not having any problem. They just want you to give some kind of a pill so that their substance stop and they'll live happily. But that doesn't occur because unless you treat the underlying condition, the underlying stress, their symptoms would not improve. It would be just a temporary kind of a thing. For example, if somebody is having headache, he just take the paracetamol, everything subside for a day. Next day, same thing happens. So it keeps on repeating. That's why you need to target the cause. So after targeting the cause, you need to find the reason, then subsequently work on those conditions. Why is he having this thing? And then subsequently you will modify your plan. Okay, what kind of a disorder is having? Why the substance is being used? Is it being used as a kind of a coping skill, as a kind of a coping mechanism, or is the substance is increasing these symptoms? And simultaneously, you will keep your approach both pharmacological as well as psychological in those lines in order to get him better. So this is how the things work. I am not going into too much details into it, what kind of a treatment is being used for each disorder, but that's the basic broad approach which we use in these dual diagnosis cases.
And I think it would differ a lot depending on the kind of disorder and symptoms as well. Right?
Yes, kind of the substance, kind of the psychiatric illnesses, kind of the personality the patient is having, kind of his approach towards the treatment. So all these things would take part into what kind of a treatment we need to provide to the patient. because rehabilitation can only occur when the patient is ready for the rehabilitation. You can't force rehabilitation on the patient.
Right.
That's
So
why we need to bring his symptoms down first.
I think that sounds like the most tricky part of the job, to be able to understand the problem when there is so much denial and resistance. It's difficult to even understand what the problem is. And with the wrong diagnosis, the treatment is not likely to work well. Right.
Yes.
Okay. So, since you have both been in the field for some time and worked in other rehabs as well, like for us to understand better how mental illnesses are treated in a rehab setting, could you share like the journey or the prognosis of a person who was seeking treatment for a mental illness in a rehab without like disclosing any confidential details, just like an overview of what it's like from the start of the journey to the
Okay.
end?
Sure, I can definitely share a few, but I'll just take like Mr. A. Okay, so the the diagnosis was alcohol dependence syndrome plus bipolar affective disorder. So the first time, like again the same story, they have tried a lot of outpatient treatment and been to several doctors, and then finally when they had come here and we did a few outpatient consultation, but finally the severity of the symptoms was such that it was a manic symptom, precipitated by heavy alcohol use. So the patient definitely was in denial, and the family had no other choice. And they were like, it's okay now. I think we can give this treatment a try. So so the patient was admitted here with us, and like you said, the tricky part is to bring in insight into them, because there's so much denial that no, this is not a problem, that minimization is so much there that it's not a problem. Many people kind of use it. It's not a significant thing that you are doing a treatment on me. So the patient was here with us for about 6 months, and I have seen the stages of development from, like, first month it was very difficult because the resistance was too hard, and then from the second month when the symptoms were it was managed, the manic symptom had come down, and slowly he was in a better state of mind, and we continued with the therapy process, the group engagement, the community testing, and by the I would say fourth month or something like that, there was active involvement in terms of the patient, and it was really nice. And we did all the steps, we finished every steps, we did the CBT, RBT, and the SMART, whatever was the care plan. According to the care plan, we completed the program, and he was discharged, and he was doing very, very well. Like, he maintained his follow-ups. Like, every 15 days he would come for his medicine, for his therapy, and even still now the patient is in contact with us, doing extremely well. And there was actually in between a phase where it was a scare, okay, that okay, probably there might be a slip. So we handle that in an outpatient setting, because the patient was with us continuously, that rapport was there, that trust was there.
Right.
Even the hypomanic episode was coming, we managed that in an outpatient setting. We didn't have to admit him. So the chances of readmission is significantly reduced if the patient is kind of attaining a certain level of recovery and maintaining contact with the treating team. So that's a big advantage. So we did with that with him, and he's doing extremely well. The family is very happy. Occupationally, he is kind of again doing his business very nicely. So yeah, so it's one of the, I would say, success story. One of the success story.
That's great. Okay. So there was a drastic change, starting with, oh, this is not a problem, to then coming and taking initiative for the treatment himself. And so what do you think brought about this change initially from that much resistance to, okay, maybe this is actually working?
Like first thing, the severity. First, he was symptomatic. He was in a manic state. So the medicines, the pharmacological treatment really helped, because no matter how much I would talk, it would not go into his head. Nothing. Like he would be so in denial. So once the symptoms start settling, I was able to kind of make a therapeutic alliance with the patient, and slowly, and not only with the patient individual therapy, group therapy, the staff, the kind of care, the recovery that he was having in terms of his physical health, that also made a significant difference. He was away from alcohol. His physical health was better. He was sleeping well. He was eating well. He was thinking clearly. He was able to absorb what we were discussing. We involved the family therapy. We involved the family also. The family also had a lot to share. So initially, the family sessions weren't pleasant, but later on, they actually were very, very helpful. So many things that they could actually talk to each other, which they would never have done it, other than the therapeutic environment. So a lot of interpersonal skills also got improved. So yes, from a very rocky road, we did kind of sail through, and we did make a difference. So yeah.
That's amazing. That's a very inspiring story. Okay. Dr. Pankaj, would you like to share anything?
That's the thing, matlab, the rehabilitation works, but the problem is this, that when we see the rehabilitation still in India, the rehabilitation is not that much. Matlab, what we are focusing on mainly in most of the institutes, it's the acute management of the symptoms. But just doing the acute management of the symptom doesn't make patient functional. That's why the core and crux of the rehabilitation is to improve his functionality and make him independent. And that's the main target which we are trying to achieve with that much amount of the care which we are giving to the patient, so that he can live his life independently as much as possible. And ma'am has already told you the story how a patient shift from one place to another place. And after doing this thing, you also feel that yes, you have did something better to the patient, and the patient also gained something from it.
Right. Yeah. It did start from a place where, even the patient did not have hope. Maybe the people around him also felt like if there is so much resistance, it's not going to work. But then as it started to work, there was no way that the patient or anyone else could deny it any further. So
Yes. And
that's great.
that's the thing, matlab, even the WHO reports that the disability which is caused by the mental illness is one of the highest among all the disorders in physical health. So
Right.
that has been the
Right. And sadly, that's the one that's most stigmatized, and people do not reach out for that much.
Most
yes.
neglected.
But it's getting better, and hopefully it will keep
Yes.
getting better.
Of
And
course.
I think MindPlus should also open centers in other states and help more people.
Sure.
Yeah. So these are all the questions that I had. Let's go ahead and take some questions from the guests. Yeah. Okay.
Okay.
So there's one question. I have been to a few clinics for my therapy, but still my condition is not improving. What do I do as the support isn't helping?
Okay. So see, at times you have to really find the right fit. So you really have to find a therapist which you would connect to. So if one is not working, probably you can actually try some. And also it would be ideal to go for a I would say assessment, because if you may need some other alternative help also. For example, if psychotherapy alone is not working, so maybe you can consider seeing a psychiatrist, depending on the assessment. The clinical psychologist will be able to assess you and might refer you to a psychiatrist if that might help.
Okay. All right. The next question is a little long. I have depression and anxiety issues from the past 30 to 35 years, and I have been taking medicine for depression, which I gradually reduced. And now I take it when it is required. So, the biggest problem I face during traveling is I cannot travel alone to a different city. I start getting anxiety. Will therapy sessions be of any help here?
Yes, it definitely will be of help, because even though, like, even though you're asymptomatic, but there are certain obstacles that you might be still facing, which we call as the residual symptoms, perhaps. So yes, we can definitely try cognitive behavior therapy to work on the belief patterns and modify the behavior, and work on your anxiety too. Yes, therapy definitely will help.
Great.
Just to add on this thing, that if he is having depression for the past 30, 35 years, taking medication as on and off basis would not do any kind of benefit to the patient. Either he has to take it or he has to take intensive psychotherapy. There is no midway between this thing.
Okay, right. And I think Dr. Pankaj, you also mentioned earlier that a person might be asymptomatic after a point, but there might be some skills that still need to be improved. And I think this is one of those cases. Okay, I hope that answered the question. Okay, there's another one. I go to bed at 12 midnight, but still can't sleep until 4 to 5 a.m. sometimes. Is this a sign of mental illness? If yes, I do not want to take therapy sessions at this point. Any tips on what I should do?
You have to have a better sleep hygiene.
Okay. Yes, ma'am. Continue.
Yeah. So one thing is that you have to really have a sleep hygiene. There's some disciplines that you might include in your daily routine, where you are going to bed at a specific time and waking up at a specific time. Avoid heavy meals after 7 p.m. Drink less water, and avoid coffee or tea or any kind of stimulants after 7 p.m., so that will help you to shut your like the brain is kind of relaxing at that point of time. And yeah, avoid heavy exercises after 7 p.m. So these little changes you can bring about. Like, you can actually search on sleep hygiene if you do not want to go to a therapist. So this is the quick solution that I can give, and I think Dr. Pankaj also can add on to this.
So one of the important thing is, if you are having persistent sleep problems, then after a certain period of time, you should visit a psychiatrist, because one of the risk factor of having any kind of a mental illness is persistent sleep problems. And the other point which the patient or the person should be considering is their use of smartphones, tablets,
Absolutely. Let's
laptops
talk
these
about
days.
that. Yes. Stay away
Because
from
these
devices.
things do tend to disturb your sleep or your sleep cycle. So if you are not able to sleep, rather than using smartphones, they can use some kind of a book or a hard book. Read that book. That would not cause any disturbance in the sleep, and they might get sleep better. So apart from what ma'am has said, they can use these things, but try to avoid the use of gadgets during the nighttime when they are on bed.
Yeah. Well, like you said, it could be, if it's happening consistently, it could be a sign of some other problem
It
as
could be,
well.
yes.
Yeah, but I think this problem was very common during the pandemic. This was a collective feeling that a lot of people related to, and their whole routine is messed up because
Yes,
you're
yes.
not doing the usual things. But yes, now I think things are getting better. Okay, we'll take one last question, since almost five. Is staying at the rehab center and getting treatment better than visiting a regular basis and visiting on a regular basis and getting sessions?
So it all depends the kind of the problem with the patient is having, the kind of the symptom the patient has been having. Then only you can decide whether this patient would be more suitable for a daycare kind of a service, or a OP service, or a intensive residential service. So that all depends on the patient profile and the patient's skill set which he has been having.
Right.
Yeah, ma'am.
Yeah, I think this is, depends on the, like, there are different indications, right? So when an outpatient therapy will work, or residential care will work. So again, I mean, you have to probably properly get evaluated for the same and then make the right decision. So yeah, decision making is also very important. So, and you can only do that by consulting an expert. So going to the right person or seeking help is very, very important.
So both have its own importance, and it depends on what the kind of problem is. I think at this point, the best thing would be to reach out to a professional and get an assessment and take a recommendation from them.
Yes.
Okay, great. So I think we'll go ahead and end the session. So again, I would like to thank both of you for joining us today. It was a lot of fun talking, and I didn't realize how 1 hour just passed by.
Yeah.
This was very insightful, and I hope it has helped a lot of people in our network. Now, before we end, is there any message that you have as a mental health professional for the listeners? Please share.
I always believe, that seeking help is a sign of courage. So you please seek help when you feel the need. And yeah, we are here. That is what I can say. That yes, we are here. Please seek help when you need so.
Really short and sweet, Dr. Pankaj.
So it's like this, matlab, try to get help. If you are feeling something, try to get help. If not mental health professional, try to get help from your social support, your friend, your family members. If they are not able to provide you the kind of the help which you are having, please contact some kind of professional, mental health professional. They might be able to help you better. They'll able to help you to reach to your goals better. So that would be the thing. So don't hesitate in asking for the help.
Okay.
Yeah, that's it.
Thank you so much to both of you. It was great having you here today. And thanks everyone else also for the active participation and all the questions. So we will be back again with another webinar. And until then, stay safe and have a great weekend. All right.
Thank you.
Thank you.
Bye. Yeah.
Thank you. Thank you so much.